Now request Dr. Meenakshi Swaminathan to talk about the adult learning principles. Before we start this program, request all the teachers to come and take the front row, because when she is going to speak, it is not going to be a monotonous dialogue. It is not going to be a one-sided way. She is going to make you involved. There will be a lot of interactions. There will be a lot of questions, there are suggestions. So it is sharing your own experiences. So sitting at the back benches, I mean, it won't really make you help in communication. So request all of you all to please come in front, so that it is a small family kind of environment and active discussion takes place, and you all can be free to talk about these learning principles. Please request all of you all to come in front. Madam, all yours.
Good morning, Amit. Now that you have primed everybody, I have to ask questions, and I have to make this interactive. Good morning to all friends gathered here. I know we all have something very much in common, which is interacting with students every day. Sometimes it feels like a battle, very often feels like a battle, but that is our common factor, and I welcome also the new people who have joined us. What is special about today's meeting is that hopefully by the end of the meeting we will form a Teachers in Ophthalmology India group, where we will unite through emails. We will also keep in touch either through a WhatsApp group or through a Facebook page, that we will share ideas, we'll share new things about teaching, evaluations, and anything new in the area of teaching in ophthalmology. So that is something, and so there'll be a paper that will be circulated. Kindly give your email and your phone numbers, and please, if you know any colleagues who are very interested, who are not present, you can take the liberty of giving their contact information as well. Okay, so I'm not very tall, so I can kind of see only some of you. So I'm going to start off by saying, how many of you here think children and adults, the way we learn as adults and the way we learned as children is very different? How many of you here think? Yeah, me too. I think most of us agree that it's very different. So our students, even though they behave like kids on most days, have to be taught on certain adult learning principles. So this is a short talk, and let me go on to the next thing. So commonest way we teach is lectures, right? So do we really need lectures? Do lectures have any advantage? What are the advantages of lectures? Anybody? With a mic, without a mic? What are the advantages? Yes, what are the advantages of lectures?
Can we have a rolling mic, the hall in charge, please? A rolling mic in the audience.
Adu kalti kodutanga. Illi irka, vera irka? Yeah.
Learning cannot be only with the help of reading. For learning, you need to listen, you need to see, and you need to work.
Okay.
So all these three factors, they contribute some percentage in learning.
Correct.
That's not only one thing that by which we can learn. So that's how all the three are important.
Right.
That is listening, saying, and then doing it.
Correct. So the lectures come into the listening part of it. Listening, paying attention. Any other advantages of lectures?
The teacher, it is a primer or introduction to the subject,
okay,
where the teacher can create a sense of suspense or enthusiasm, and create interest in them to go and read on their own.
Wonderful. So it creates curiosity and interest in the subject. Yes.
That apart, the time factor also is there, because the lecture of 10 minutes is different from 1 hour lecture. So you plan according to a 1 hour lecture or a 10 minutes and impart the information in that particular stipulated. It is mostly a one-sided thing. Maybe at the end of the session, if you have some time, you can have interaction.
Interaction. So yeah, so he has spoken about the advantage and the disadvantage. Disadvantage being it is a one-sided thing mostly, but advantage, you can make it into an interactive session also, correct? And curiosity is started off, and depending on the topic, you can make it a short lecture or a long lecture. Absolutely. So you had another point. Yes. Absolutely. Fantastic. You address a large number of students at one go, which you can't do in clinics.
But we are talking about adult learning principles. Do adults are really interested in listening to one-sided monotonous lectures?
Exactly. Very good point. are the adults really interested in just sitting there and listening to somebody drone? So we're going to, but yet if you look back at our way we teach in colleges, in our institutions, it is mostly a lecture. It's mostly a class. So let's look through what are the pros and cons of lectures. So as you correctly said, you can impart knowledge to a large number of students, and maybe UG teaching, lecture is a good idea. It's inexpensive. You don't need anything. It's not like a wet lab teaching where you need a big investment or a surgical microscope, etc. It is easy. You just need a projector, okay? It's adapted. Like somebody said, you can adapt it to any audience and topic. You can have a short lecture, you can have a long lecture, you can very adaptable. And like correctly Dr. Sandhya said, you can stimulate interest. If you're a good lecturer, you can stimulate interest, you can discuss controversial topics, you can call for interaction and debates, and it gives a clear perspective. Like if you're a lecturer, you at the end of the lecture, hopefully you have said, this is what is important about this topic, which is something very often the PG doesn't know if they give the class. Okay. What is the problem about lectures? It's passive, right? Many of you said it's one-sided, correct. And if you do not have lack of clear objectives and structure, it can be like wishy-washy and sort of all over the place and boring. And sometimes the audience the topic may not be relevant if the lecturer has not bothered to find out what the audience already knows. And sometimes there is a disconnect from the student's real life perspective. And of course, this very big thing, keeping attention. Post-lunch sessions, you find half your students are dozing off. I even found one or two on their mobile phones, and it's, it's tricky, keeping attention. So, adult learning principles, there are several theories. We are not going to, thankfully, we are not going to go into any of these theories. But there is instrumental learning theory, there is humanistic theories, there are transformative learning theories, social theories of learning, motivational and reflective models. But let us dwell on Malcolm Knowles, 1970, who said, adults need to know why they have to learn something before undertaking to learn it. Which means you need to have a needs assessment to be done before the lecture so that the content is relevant. So you need to know, for example, you have a large student of medical students sitting there. What is their interest in your class? They need to be able to pass their exam. That is their interest. They are not going to take your what your knowledge you're imparting and go start practicing ophthalmology, right? So the way you will teach a topic, phacoemulsification, to a medical student, it is different from how you will teach it to your exam-going student, right? Exam-going PG student. So it is fundamental to introduce goals and objectives at the beginning. So the learner, your student, needs to know what is really the objective of the lecture. What do you hope to learn at the end of the lecture? So it's a very good idea to give an outline at the beginning. So learner self-concept, that is teachers to help adult students become self-directed learners. You can't teach everything in a class. You have to help them become self-directed learners so that they can control, motivate, supervise, and adjust their own learning. Because remember, learning is a lifelong thing for them. For all of us, learning is lifelong. Encourage active learning instead of passive learning, instead of being spoon-fed. So like somebody said, you can have interaction at the end of the class, you can have debates, you can have quiz programs, you can have the case presentation and discuss from the PG point of view. All these are ways in which to make it interactive and similar to their real life situation, which they will face in their clinic and in their practice. So remember, many of the learners come with accumulated experience and biases. I think many of you may be teaching post-DO or post-DO DNB or post-DO MS. They already come with certain biases. They come from different programs. They come, sometimes they have been in service and they come. So these, you have to remember that they may have accumulated bias and experience, and you have to be sensitive to that before you start imparting your knowledge. And so inclusion of techniques such as group discussion, debate, case-based methods makes your lecture or your passive, so-called passive transference of knowledge much more interactive and interesting. And new information must connect to previous knowledge. For example, if you're going to teach Rexis, it's nice to first revisit beer can capsulotomy, talk about what are the disadvantages of that. This is because many students who do ECC may be familiar with that. And then you introduce Rexis and say what are the pros and cons of Rexis, which is has a learning curve, as opposed to beer can. Then they remember it better because you have connected it to the previous knowledge. So what they need to know to cope with situations in real life, so you could demonstrate it with little video clips of FACO and ask them to describe what went wrong and how they would prevent this step from occurring. So if you use real life examples, they are likely to remember what you say better. And lecturer can also add value through personal anecdotes, and sometimes it may lead to better salary or job performance if they pay attention, and if you point that out, they are likely to, or passing in the exam, which is like equal to all that, then they are likely to pay attention better. So remember, 20% of what they hear is what adults retain, 30% of what they see, 50% of what they hear and see, 70% of what they hear, see and say, and 90% of what they hear, see, say and do. And that's all I have to tell you about adult learning principles. Remember all these things while you plan your next transfer of